counseling psychologist from the Makati Medical Center as well. A phobia is a fear of one particular trigger that's divided into three main groups. Dr. Teddy, can you explain what these are?
For a specific phobia, this is for a specific object or situation. It can compromise everyday life. So whatever the phobia is, it causes a great deal of anxiety and stress, anxiety, and it gets triggered but when that event happens, that situation happens.
Complex phobias, on the other hand, have triggers that are less recognizable, such as leaving the house or being in a large crowd. Social anxiety and agoraphobia fall under this group. Dr. Go, could you tell us more about this and how does one develop it?
So social phobia, or otherwise classified as social anxiety disorder, as the name implies, is a condition where a person experiences marked fear or anxiety when he is in a social situation, fearing that he will be evaluated negatively. So they are afraid of being judged negatively by people for whatever reason. This is social anxiety disorder or social phobia. On the other hand, agoraphobia is marked stress or fear inducing panic symptoms when you are placed in a situation where a person cannot escape or is stuck in that situation.
Now, as society changes, the list of potential phobias also change. One example would be nomophobia, which is actually the fear of being without a cell phone or a computer. And as you can imagine, this has developed recently, and because people do get very attached to their gadgets and can't function without them. Dr. Go, what are some of the more commonly known phobias?
I think the more common phobias nowadays, especially given the pandemic, is really germophobia. Now, this falls under specific phobia wherein people, because of the pandemic, is really aversive or afraid of getting exposed to viruses, germs. That's why we are taking care of ourselves. The problem is the overestimation of fear that sometimes can affect how we live our lives.
Acrophobia, or the fear of heights. Now, this phobia makes people avoid higher floors of a building, maybe bridges, maybe mountains. Dr. Teddy, what happens when someone with this kind of phobia is exposed to these?
Even the idea that they are about to enter such a situation will really stress them out. So they will avoid it at any cost. They will try to work their way around it, just to avoid it.
Now, another common phobia is aerophobia, or the fear of flying. Now, in terms of fatalities, air travel is actually safer than any other common mode of transportation. But Dr. Go, what causes this type of phobia then?
The causes would be news, like when we hear about plane crashes, which is quite uncommon nowadays, but it can still have an impact on people, or air accidents. No, these are things that would make a person fear riding a plane, or even the actual experience of turbulence while inside a plane. So all of this could elicit a certain overestimation of fear that is already inappropriate and sometimes incapacitating because a person actively avoids that phobic stimuli.
Phobias of spiders can have a far more significant impact on your life. So having arachnophobia can prevent someone from participating in certain situations because their mind tells them that you're in danger from spiders. How can we tell if it's normal fear or just preservation, or if this is already an actual phobia?
In order for us to classify or diagnose that this is already a phobic reaction or a phobia that needs to be addressed, is that it is very persistent. Like, it's almost always when a person sees the phobic stimuli, there elicits a response. And the response is normally considered inappropriate or exaggerated or extreme, to a sense that it creates a lot of fear, so as making a person unable to proceed with his activities.
Does the sight of blood make you feel faint or even squeamish? While some people feel uneasy about blood from time to time, hemophobia is an extreme fear of seeing blood. Dr. Teddy, how does having this impact someone's life?
They'll make up any excuse. They will create an environment that they feel safe. So that may be in their homes, and they will If they go beyond that border, then they may feel the symptoms. Anxiety, the stress is there. It persists perpetually in almost all situations. And this would be good markers for definition if somebody is suffering from phobia.
Now, another phobia on that list is claustrophobia. It's an irrational and intense.
Sa inyong pagprindag mga butang, adtua karon ang Caraga Pawn Shop. Taas ang ilang dawat sa mga alahas, ubos ang interest rates, ug walay liquidated damages. Caraga Pawn Shop nahimutang sa convenient locations dol sa City Hall, ground floor sa Nimco Building, Dalan Rizal, ug sa Nicolas Canto Cervera. Caraga Pawn Shop, ngalan nga kasaligan sa inyong pagprindag mga butang.
RPN Radio Philippines Network, Radyo Ronda DXKS Surigao, member kapisanan ng mga broadcaster ng Pilipinas.
Specific phobias are long-lasting and cause intense physical and psychological reactions. It's not like the brief anxiety you feel when taking a test or maybe giving a speech. I'm Dr. Freddie Gomez, and you're watching MedTalk Health Talk on CNN Philippines. What are some of the impacts of phobia on a person beyond the symptoms?
You have to remember that these people who experience phobia, they can recognize that they are avoiding the situation because of their fear, but they may actually like to perform in public. They just fear to be judged. Similarly, for agoraphobia, patients may become homebound in its most extreme state because of their fear of being exposed in situations where escape is difficult. So they just stay in their home, confined in their home, because they feel that it is their safe place, so to speak.
Dr. Teddy, how does this impact the person's life, especially in children?
One way that you can work towards conquering or managing your phobia would be to constantly expose yourself to situations that, for lack of a better word, make you feel uncomfortable. So they not being exposed to other kids may actually make it a little bit more difficult when they finally get to socialize with other people.
Can a true phobia, someone who's diagnosed with a phobia, affect their mental health overall?
This can actually develop into a full-blown anxiety disorder or a mood disorder. Many times, patients who have phobia can also have a comorbidity of substance use disorders. This is all because of the tendency of a person to try to appease his fears by taking some downers like alcohol or something to calm them, like substances.
A specific phobia can actually lead someone to have substance abuse problems. So can you explain this and why this is the case?
I'd like to cite a case where a patient would first came to me and said, I always fear exposing myself in public, but I cannot because that's part of my job. And this person would normally take a little dose of alcohol before he would have to speak in front. The problem was, as time went by, his alcohol consumption went on, and later on his function was compromised and his alcohol consumption just went up. So his intention was to really calm himself, but instead of just calming himself, he developed a different kind of addiction, which actually complicated the matter. So these kinds of comorbidity actually exist, and that's why we really need to pay attention as to what the underlying cause and the focused diagnosis that professionals must guide patients to resolve.
Yes, because the risk of suicide or self-harm also increases for some individuals with specific phobias. Why does this happen, Dr. Go?
This happens because the person is struggling to try to control a situation that he is having difficulty controlling. You know, this feeling of control is innate in every individual. And in so doing, he is having difficulty to control a certain situation, but it also makes it more complicated because there are a lot of undesirable reactions in his body that he is experiencing, a person may actually do something harmful as a consequence of this struggle.
Now, Dr. Teddy, is there a way or how is a phobia diagnosed?
Maybe a family member brings the patient for consultation because they may not be willing to do it themselves. So maybe that's a start. Or the family member shares their experience. If the patient is open to sharing.
If someone were to seek consult, say, for a possible, what they think they have is a phobia, what would the initial screening look like?
The process with a psychologist is usually 50 minutes. So during that time, there's a lot of
Biologic Systems Computer Center. Nagpahibalo sila nga modawat nag home credit applications kung ikaw gusto mo palit og laptop, desktop, magpa-build og gaming PC, printer ug uban pang IT products. Pwede na pinagi sa home credit. Apply na karon dayon sa Biologic Systems Computer Center diya sa may Dayan Magallanes and Ela Service Center dito sa may Dayan Himina ning syudad sa Surigao.
RPN Radio Philippines Network Radyo Ronda DXKS Surigao. Member, kapisanan ng mga broadcaster ng Pilipinas.
There is treatment for most phobias, and people who have them are nearly almost aware of their disorder. I'm Dr. Freddie Gomez, and you're watching MEDTALK Health Talk on CNN Philippines. Dr. Go, let's talk about the treatment or the therapy portion of someone who is properly diagnosed with a phobia. What happens?
Patients who come to us normally already have an idea that there is something wrong about their behavior, about how they are managing their fears. However, they struggle. Hence, they come to us. Now, when they come to us, the first thing is to identify what is the phobic stimuli and how they are behaving towards it. These are the cognitions that we need to be able to identify with our patients in order for them to appreciate that, okay, this is the one that's causing my fear, and what should be my approach, proper approach to it. So when a person can already correct that cognition, he can now start to expose himself slowly, gradually, like the sensitization therapies, slowly exposing himself through imagine, through actual exposure. That's number one. Number two is, of course, psychotherapy, wherein we talk to our patients about the proper behavior of coping with it. Like if they see there is something wrong about their behavior, then they would be willing to adjust to it. Of course, there are also treatment modalities like pharmacotherapy, wherein a person can take some medications in order for them to properly manage their fear or anxiety symptoms.
What is the risk behind this? What can you advise those who are experiencing this?
Well, these are some lifestyle phobias that patients can identify themselves. But what's most important is for us to get some guidance from professionals. No? I think that is the most important thing that patients can do for themselves.
Dr. Teddy, can you please give us some of the examples of simple changes that people with phobias can make in order for them to get started?
They must have a level of compromise that works for them. Not a level of compromise that somebody dictated on them, but something that they can that they find they can live with.
What can family members do if they have a loved one who has a phobia?
Again, depending on the phobia, they can reassure them that they are fine. That's probably the family support. That's where they can help the most. And if the patient should fall back into their usual routine, they can help them course correct.
Is giving a pill to lower someone's anxiety the best way to manage phobias?
The best treatment outcomes will always be a combination of psychotherapy and pharmacotherapy. but it is not always the case in terms of initial treatment. Of course, the first thing that we need to do is to identify first the situation and if the patient is going to be amenable to taking medications.
Are there any self-help techniques that you could share with our viewers to hopefully help them start to manage their phobias?
The first thing I think with self-help is really correcting negative conditions, like acknowledging that the fear is overly estimated, that there might be some thing that you need to tone down a bit in terms of how you appreciate the fear for a particular object. Another thing is, of course, to try to desensitize yourself by exposure therapy slowly, by just imagining that this object may not be as fearful or worrisome or anxiety-provoking. Deep breathing exercises will always be effective. And of course, seeking help whenever it is already necessary professionally will, of course, also be very important.
And with that, I hope our discussion was very helpful to all our viewers today. And thank you, psychiatrist Dr. Jerome Go and psychologist Dr. Ramon Eduardo Villasor. We want to be your partner for a lifetime of good health. I'm Dr. Freddie Gomez, and this is MEDTALK Health Talk on CNN Philippines.
RPN Radio Philippines Network, Radyo Ronda DXKS Surigao, member kapisanan ng mga broadcaster ng